Good evening. My name is Rich Napolitano. I am the Chief Strategy Officer at Greater Lawrence Family Health Center. Welcome to the 16th Annual Making a Difference Gala. Unfortunately, this year we have to have it as a virtual gala, but it's still special nonetheless. Before we get going with tonight's agenda, I'd like to introduce our board chair, Charlie Zanazzi, to offer some welcoming remarks.
Good evening. I'm Charlie Zanazzi, the chair of the board for Greater Lawrence Family Health Center. On behalf of the board, I want to thank you all for being part of this evening's 16th annual Making a Difference Gala. I'd also like to thank Congresswoman Lori Trahan for being our featured speaker tonight. And I want to congratulate Secretary Marylou Sudders for being the recipient of this year's Making a Difference Award for all of her work on COVID relief and support of community health centers throughout the state over the past year. Finally, I'd like to thank the staff of the Greater Lawrence Family Health Center for their tireless efforts on the front line to combat this COVID pandemic and to return our community to health and to well-being. Thank you for being a part of this evening's event, and please enjoy.
Thank you, Charlie. We appreciate those welcoming remarks. Now I'd like to introduce John Silva, our President and CEO, to offer some remarks from the Health Center.
Thank you for joining us this evening for the 16th Annual Making a Difference Gala. Tonight's gala, although it is virtual, is still a very special one, and it's the first one we've been able to have over the last 2 years. Despite the challenges we have faced over the last 15 months from the pandemic, we gather this evening to welcome and recognize two very special friends of Greater Lawrence Family Health Center and all health centers throughout the Commonwealth. First, our featured speaker this evening will be Congresswoman Lori Trahan, Massachusetts 3rd Congressional District. Congresswoman Trahan has been one of the leading supporters in Washington, D.C., and throughout our state on all matters affecting community health centers, our staff, and patients. She has become a true friend of Greater Lawrence Family Health Center. She has led the charge in support of future stable funding, not only for community health centers throughout the country, but also for teaching health centers throughout the country, including our well-known Lawrence Family Medicine Residency Program. When the pandemic hit us all, Laurie has worked tirelessly on behalf of her constituents to deliver essential support to families, frontline workers, and businesses, as well as students. Laurie secured federal funding for community health centers and community action agencies across the 3rd District, working to provide critical services to low-income and traditionally underserved families. As communities and businesses in the 3rd District work to get on the path to recovery, Laurie is committed to seeing that they cross the finish line and get back on their feet and do so stronger than ever. The Congresswoman now serves as a member of the powerful House Committee on Energy and Commerce. That is very impressive given that this is only her 2nd term in Congress. She is an advocate for all Bay State residents on pressing issues, including making healthcare more affordable, addressing climate change, protecting children online, and fighting disinformation in our media. I am pleased to welcome Laurie as our Making a Difference keynote speaker.
Hi, I'm Congresswoman Lori Trahan. As a proud supporter of the Greater Lawrence Family Health Center, I couldn't pass up the chance to take part in the 16th Annual Making a Difference Gala. It's thanks to the heroic efforts of every single person working in every one of your facilities that we can finally see a light at the end of the tunnel that is this pandemic. But your successful efforts come as no surprise to those of us who have had the pleasure of working with you over the years. In fact, for the past 4 decades, Greater Lawrence Family Health Center has played a pivotal role in our community by providing a network of high-quality, comprehensive healthcare services, including top-notch primary care, addiction treatment, and treating vulnerable families and individuals. But when the pandemic struck, you all rolled up your sleeves, you put on your masks, and did the hard work necessary to save lives. It's because of you that folks throughout the Merrimack Valley weren't left behind as we responded to the virus, first with testing and treatments, and now with vaccine distribution. As a member of the House Energy and Commerce Committee, which oversees healthcare policy at the federal level, my top priority is ensuring that communities here in our district have access to quality, affordable health care. And you all are the perfect example of achieving that goal, not only across the Commonwealth, but also across our country. Community health centers like Greater Lawrence Family Health Center have been on the front lines of the fight to provide good health care to those who otherwise wouldn't have it, and that's been especially true over the past 15 months. We owe it to you all to have your backs just as you've had ours. Not only must we push at the federal level to continue investing in community health centers like yours, but we must also have strong state and local partnerships, just like the ones established by Greater Lawrence Family Health Center. At the state level, we have a strong ally in Secretary Sudders, who is more than deserving of this year's Making a Difference award. The Secretary has helped navigate the Commonwealth through an unprecedented health crisis, and she's done so by following the science and putting our workers, our families, and students first. It's thanks to her tireless work and that of so many others that our state has emerged as a leader in COVID response, especially vaccinations. But we all recognize that now is not the time to take our foot off the pedal. And in communities like Lawrence, Haverhill, and Methuen, we have so much work still to do. Now, before I leave you, I'd be remiss if I didn't also acknowledge another wonderful partner who I've had the pleasure of working closely with for a number of years, John Silva. For several years, we've been fortunate to have John at the helm of the Greater Lawrence Family Health Center. Through his work, the health center has transformed and expanded far beyond what anyone could have anticipated. He's increased patients' access to health care in communities you serve, including by opening locations in Methuen and Haverhill, and he's made bold investments in behavioral health and substance use disorder services. And of course, in the face of the pandemic, John's steady leadership helped guide his staff and the patients they serve through constantly changing challenges each day, all while maintaining excellent services to those who need them most. Communities across the Merrimack Valley have benefited greatly from his commitment and his love for this facility and our community. And although he will be sorely missed, I know we're fortunate to have had him this long, and I join everyone celebrating today in wishing him all the best in the next phase of his life. In closing, I just want to say once again how grateful I am for everything each of you at Greater Lawrence Family Health Center do. As we continue working to defeat this virus and recover as a community and a Commonwealth, we can't do it without you. So please, stay safe, stay healthy, and I look forward to celebrating again with you in person soon.
Our Making a Difference Award recipient is Marylou Sudders, the Secretary of Health and Human Services for the Commonwealth of Massachusetts. Secretary Sudders is being recognized with our most prestigious award for all she has done and continues to do for the citizens of Massachusetts. Marylou Sudders serves as the Secretary of Health and Human Services for the Commonwealth of Massachusetts, overseeing 12 agencies and Mass Health, with a combined budget of $24 billion and 22,000 public employees, delivering essential services that touch the lives of 1 in every 4 Massachusetts residents. In all my time working in community health centers in several states, Secretary Sutter is the best Secretary of Health and Human Services I have ever worked with. When in need, the Secretary has always stepped up to ensure the delivery of sound, quality health care to Massachusetts residents as her top priority. Since joining Governor Baker's cabinet in January 2015, Sudders has advanced strategic policy priorities, including restructuring Mass Health into a population-based healthcare system, reforming the child welfare system, addressing the opioid epidemic, and integrating physical and behavioral health care and strengthening community-based services. Her response to the COVID pandemic has been nothing short of remarkable, as she has worked tirelessly to ensure our residents were cared for with the Stop the Spread testing initiative throughout the state of Massachusetts. She also led the creation of mass vaccination sites throughout the Commonwealth and with the Department of Public Health supported our community health centers in leading the charge to distribute the vaccine to our most vulnerable patients and residents. The current status of the vaccination distribution throughout the state is still a top priority, with the community health centers leading the way. Thanks again to the Secretary and Governor Baker. Massachusetts is one of the top 5 states in the nation in vaccination distribution under the Secretary's leadership. Doses distributed to the state right now are 9,481,590 doses. Doses administered, over 8 million. The percentage of distributed vaccines that have been administered, 87.35. For her work in ensuring that all residents of Massachusetts have the same access to quality health care, and for her response and tireless efforts facing the pandemic, Secretary Marylou Sudders has certainly made a difference for all of us and is a very, very worthy recipient.
Buenos noches, everybody. This is Massachusetts Governor Charlie Baker, and it's an honor to join you tonight to celebrate the great work of Greater Lawrence Family Health Center at your annual gala. My wife Lauren and I have had the privilege of attending this gala in the past, and it's a very special event. There are usually over 400 people in attendance, and they're all there to celebrate the health center's incredible work to advance the health and well-being of the people of Lawrence and the region. Your CEO, John Silva, and his team are an incredible asset to the community that you all serve. And while it's unfortunate we have to gather virtually one more time, I'm still glad to have the chance to share a few thoughts with you tonight. And I'm grateful for your decision to honor Secretary Marylou Sudders with the Making a Difference Award. Marylou and I have known each other for a very long time, and I can think of no one more deserving of an award that's all about making a difference and improving people's lives. Her commitment to the well-being of the residents, children, families, and communities in Massachusetts has always been unmatched, and that's been especially true this year. Her leadership of our COVID-19 Response Command Center has been defined by her steadfast dedication to fighting this terrible virus, supporting the vulnerable among us, and promoting policies that lift up all our residents. Under Marylou's leadership, one of the key components of the Command Center's response to the virus has been a testing program and vaccine rollout that's been done in a strong partnership with community health centers. She and I have both talked a lot about how important community health centers have been, particularly because they are such trusted voices and trusted institutions in their communities. They're deeply committed and connected to the neighborhoods they serve. They have lots of history there, and that's why they were ideally positioned to support both our testing program and our vaccine rollout. Places like Greater Lawrence have administered hundreds of thousands of doses of vaccine, done hundreds of thousands of tests, protecting their residents and their communities. Early on in the rollout, Marylou had a chance to visit a vaccine clinic run by Greater Lawrence Family Health Center with me at a senior housing facility. For both of us, that visit underscored the deep commitment to your neighbors that's defined the work of this health center for years. Now, as we start to emerge from the pandemic, and Lawrence is yellow, we look forward to continuing to partner with health centers like Greater Lawrence to build healthy, thriving communities here in the Commonwealth. But for now, I just want to reiterate my thanks for your decision to honor Secretary Sudders tonight, somebody I've known for a very long time, I hold in very high regard, and I just want you to all to know that over the course of the past year, she's pretty much been on it 24/7, 365. She and I talk at 6 in the morning, she and I talk at 8 at night, she and I talk on Monday through Sunday. And in many respects, she's carried a tremendous amount of the burden that's associated with making decisions when you're dealing with constantly changing facts on the ground and so many other challenges of dealing with what, of course, was a novel coronavirus, something we were learning about as we went. So thank you again for honoring Marylou, and thanks for this opportunity to share a few thoughts. I hope you all enjoy the rest of the program, and I really look forward to having a chance to see you in person sometime soon. Take care.
I wanted to take this opportunity to congratulate Secretary Marylou Sudders someone I've gotten to work with over the years, but particularly within the last year or two. I think about a quote that I learned many years ago. It said, a person who is worthy of being a leader wants power, not for himself or herself, but in order to be of service. It is clear. It is clear in all the years that I've been dealing with Health and Human Services and with Secretary Sudders that she wants to be of service. That this is not about power and influence. It's not about the politics. Her life has been a testament to that. We are fortunate in Massachusetts. We are fortunate at the Massachusetts League of Community Health Centers to have a state where Marylou Sudders is in leadership and has often reached out to us, both my predecessor, James W. Hunt Jr., Dr. Hunt, and then would eventually reach out to me when I assumed this role and say, what do you need? When do you need it? Do you need me to show up and speak to your members? And what's the challenge? And she has been a partner, an ally in the work to respond to those challenges. So to you, Secretary, Madam Secretary, I say thank you. I say congratulations. And I look forward to our next early morning conversation and whatever life has in store for your brand of leadership. I want to say thank you.
On behalf of the Board of Directors, our CEO, John Silva, and all of our staff at Greater Lawrence Family Health Center, we're here to give this award to Secretary Marylou Sudders for making a difference in all of our lives, especially the work that you've done with all of us in terms of the COVID pandemic and the challenges our patients faced every day, but also the support that you've given community health centers over the years. So thank you so much for making a difference in all of our lives.
Thank you. John, Rich, the entire team at Greater Lawrence Family Health Center, from direct care staff, management, and the board, I'm grateful for your efforts each and every day. And a shout out to Congresswoman Trahan for being with you. Greater Lawrence Family Health Center is a really remarkable lineup of great advocates for the health of our residents in Merrimack Valley. It's an honor to receive this award, and I'm very touched. Frankly, Greater Lawrence Family Health Center and all of our community health centers deserve an award for making a difference, particularly this year. CHCs have never been more essential to keeping our residents healthy than they've been doing these past 15 months. You've been a critical part of our pandemic response: testing, infrastructure, contact tracing, and now, of course, vaccine distribution and administration. One of the reasons that Massachusetts has among the lowest vaccine hesitancy in the nation is because of you, our community health centers, trusted voices in and of community. In Massachusetts, CHCs have administered over 700,000 of the COVID-19 vaccines to your patients and community members since the rollout began. There's a reason why we're a national leader. There can't be a one-size-fits-all model, and you have and continue to be innovative, nimble, caring, and respectful. Greater Lawrence Family Health Center pivoted to meet demand, and you remain nimble, vaccinating some of our most vulnerable residents in the Merrimack Valley. I experienced it myself at the Salem Street Housing Authority vaccination clinic in Lawrence a few months ago. The relief and joy in the faces and demeanor of the older adults was palpable and serves as an important reminder to us that this work matters and every dose counts. It gets residents one step closer to seeing their families, to visiting their favorite local shops and bodegas, to attending in-person services on Sundays. And we know that some of our most difficult situation that folks are experiencing, such as homelessness, has only been exacerbated by this pandemic. The team at Greater Lawrence has been ensuring equitable access to vaccine and making sure no one gets left behind. We are grateful for your commitment to equity and your can-do attitude. The Baker-Polito administration supports our community health centers because we recognize the importance of neighborhood healthcare organizations such as Greater Lawrence. We've provided more than $52 million in supplemental funding including over 8.8 million for vaccinations in community health centers. And we will announce, or I guess I'm announcing right now, an additional 3.1 million that will be released shortly for our community health centers. And you have our commitment. There will be more financial support, sustainable for the future for our community health centers. And this federal government has also acknowledged the importance of community health centers, with more than $220 million in federal payments to stabilize services within your centers to ensure continuous access. Looking back on this past year, one of the things that stood out to me most about our state's response to the pandemic is the way that our healthcare partners truly functioned as a system, a real network, putting aside competition for true collaboration, putting our residents' healthcare needs first. I also wanted to say a special thank you to John Silva. 41 years of service in community health. We're glad you came back to Massachusetts. We're grateful to you for all that you've done, and especially in Greater Lawrence. My very best to you as you pursue your next personal chapter. I am truly humbled by this award and the collective work of so many. So I accept it on behalf of all of you for what you do today and what I know you will do tomorrow. Take care.